Welcome to this explainer. I am so glad we are gathered here together today. We're going to talk about something that can feel, well, very frightening when it happens, but it is deeply, deeply important for all of us to understand as a community. Imagine you are walking down the street or sitting in a cafe, and suddenly a neighbor near you begins having a medical emergency, a seizure. It is so easy to feel helpless, right? To feel panic? But today, our crucial goal is to change that fear into collective knowledge. We are going to learn how you can safely navigate this exact situation. We are going to learn how you can literally be the calm in someone else's storm. Now, before we really dive in, I want to assure you that the knowledge we are sharing today is rooted in deeply respected medical expertise. All of this vital information comes directly from the neurology experts at the F.E. Dreyfus Comprehensive Epilepsy Program, which is a part of the University of Virginia Health System. We are relying on their absolute best guidance to ensure we know exactly what to do. So, here is our roadmap for today's explainer. 1. Understanding seizures. 2. Recognizing types. 3. Essential first aid. 4. What you must never do. And 5. When to call for help.
All right, let's jump right into sections 1 and 2, understanding seizures and recognizing types.
When we think of a seizure, we often picture what television and movies show us, right? Dramatic falling and shaking. But the reality is actually much broader. Some seizures are quite subtle. For instance, with a simple partial seizure, the person actually maintains normal awareness, but they might experience isolated twitching, sweating, dizziness, or even weird disturbances to their hearing and smell. Then there are complex partial seizures. Here, the person is completely unaware of their surroundings. You might just see them staring, completely motionless, maybe repetitively picking at their clothes, smacking their lips, or just wandering around aimlessly. And an absent seizure? Well, that is just a brief moment of unconsciousness. The person might simply appear to be daydreaming or spacing out. It is very quiet.
Now let's contrast those milder types with seizures that involve much more physical and motor activity. An atonic seizure involves a sudden loss of muscle tone. The person may suddenly fall to the ground, though recovery is usually quick. A myoclonic seizure brings brief, forceful jerks that can affect the whole body or just a part of it, sometimes severe enough to cause a fall. And then we have the tonic-clonic seizure. This is the severe one people usually imagine. It involves a sudden loss of consciousness, body stiffening, and an unprotected fall to the ground, followed by forceful jerking movements. You might even see a blue tinge around their mouth, and, loss of bladder or bowel control can occur. Usually after 1 or 2 minutes, the jerking stops and consciousness slowly returns.
So, the absolute crucial distinction we must make regarding our response is this. For those briefer, non-convulsive seizures we discussed first, like the absence or complex partial seizures, where someone is just unresponsive or staring, no specific physical first aid measures are actually required from you as a bystander. You just wait, observe, and ensure they are safe as the brief episode passes.
Moving on to Section 3, Essential First Aid Steps.
Your very first actions set the tone for everything that follows. Step 1, stay calm. Your calm presence is your absolute greatest tool here. Step 2, check your watch to time the seizure's length. Note exactly when it starts and when it ends. This information is vital for medical professionals later. Step 3, prevent injury. Now, do not try to move the person. Instead, move the world away from them. Clear away any hard or sharp objects that they might hit while they are jerking uncontrollably.
Once the immediate area is safe, you must protect their body, especially their head and airway. Step 1, place something soft like a folded jacket or a sweater directly under their head. Step 2, gently loosen any tight neckwear like a tie or a tightly buttoned collar. Step 3, turn the person gently onto one side. This is so important because it helps keep their airway clear and allows any fluids to drain from their mouth. And remember, even though they may turn a bit blue around the mouth, lack of oxygen is actually rare because their breathing during the seizure is quite forceful.
But listen, first aid is not just physical. It is deeply emotional and social as well. You are protecting their dignity. Keep curious onlookers away. Give the person space. Make them as comfortable as possible as they begin the slow process of waking up. Be profoundly sensitive and supportive, and kindly but firmly ask others in the crowd to do the very same. Coming out of a seizure can be confusing, it can be exhausting, and a friendly, supportive environment makes all the difference for our brothers and sisters.
Section 4, what you must never do.
For generations, people have shared this popular belief that you must put a spoon, a wallet, or a stick in a seizing person's mouth so they do not swallow their tongue. Well, the medical reality is starkly different. Swallowing your own tongue is physically impossible. Furthermore, efforts to hold the tongue down by forcing objects into the mouth will only cause terrible injuries to their teeth, their jaw, or even your own fingers. You must absolutely never put anything into the person's mouth. Period.
Here is another incredibly important rule straight from the experts. Quote, if the person having a seizure thrashes around, there is no need for you to restrain them. Do not hold the person down. Not only is it completely unnecessary, but restraining someone who is having a seizure actually makes them more combative. You also have to consider your own safety. Just let the seizure run its natural course while keeping the space around them safe.
And a final, vital warning on what not to do. Even if they are beginning to wake up and seem tired or thirsty, do not give the person water, pills, or food until they are fully 100% alert. If they are still partially unresponsive, their swallowing reflexes will not be working properly, and they could very easily choke. So just wait.
Finally, Section 5. When to call for help. I really want you to remember this critical number threshold, 5 to 10. Earlier, we talked about looking at your watch the moment the seizure begins. Well, this is exactly why. If the active, jerking seizure activity does not stop after 5 or 10 minutes, you are no longer just observing. You must immediately call for emergency help. A seizure lasting this long is a serious medical emergency that requires professional intervention.
However, if the seizure runs its course in just a minute or two, the outcome is quite different. If the jerking stops and the person awakens and slowly returns to their normal state of awareness, there is actually no need to call for emergency help or rush them to a hospital. For someone with a known seizure condition, this is simply an event that has passed. Your job was to keep them safe while it happened, and you did exactly that.
We have journeyed through the science, the physical steps, and the myths of seizure first aid. You now possess the knowledge from the University of Virginia Health System. You know to clear the space, to time the event, to cushion the head, and to gently turn them on their side. Most importantly, you know never to restrain them and never to put anything in their mouth. So my friends, I leave you with this question. Now that you know the facts, are you ready to be the calm in someone else's storm? I truly believe that you are. Thank you for learning how to protect and care for our neighbors today. Keep this knowledge close to your heart.